Hello guys, welcome to Physio World. This is our second lecture on sports injury and today we are going to discuss rotator cuff tear. First we will see what is rotator cuff tear. Rotator cuff is a group of four muscles: infraspinatus, supraspinatus, teres minor and subscapularis. Here you can see these muscles: infraspinatus muscle, supraspinatus muscle, teres minor and subscapularis. These muscles work together to produce a great range of motion and stabilize the shoulder. Any injury to any group of these muscles and their tendons is called rotator cuff tear. Mechanism of injury: repetitive overhead activities like throwing a baseball, tennis, golf, all these activities can cause rotator cuff injury. Individuals who are doing job like mechanics, painting, musician and others, when the arm is required to be overhead for a long period of time, are also prone to develop injury. Traumatic events such as fall on outstretched hand can also cause injury. Risk factors: age, certain sports, construction jobs, and family history. These are the risk factors of rotator cuff tear. First, we will see age. Rotator cuff tears are most common in peoples older than 40. Certain sports athletes who regularly use repetitive arm motions are prone to develop a rotator cuff tear. Construction jobs, carpentry, house painting require repetitive arm motions, often overhead, that can damage the rotator cuff over time. Family history: there may be a genetic component involved with the rotator cuff injury as they appear to occur more commonly in certain families. Assessment criteria: first, we will take the detailed history. You will notice pain around the shoulder, sleep disturbed by pain, weakness during daily activities. There may be history of trauma and occupation that can cause rotator cuff tear. After taking detailed history, we will do physical examination. In physical examination, first we will done inspection, then palpation, then we check the range of motion, and at the end we will see strength. Special test to confirm the rotator cuff tear. First test we can perform is empty can test. This test is used to confirm supraspinatus injury. In empty can test, shoulder is positioned 90 degree of abduction with full internal rotation and 30 degree of forward flexion. Therapist will apply a downward directed force to the arm. Here you can see the direction. The patient tries to resist this motion. This test is considered positive if the patient experiences pain or weakness with resistance. Next test we can perform is the lift-off test. This test is used to confirm injury to the subscapularis muscle. In this test, the patient lifts his hand away from the back, and an inability to perform this action indicates a lesion of subscapularis muscle. Resisted internal rotation test. This test is used to confirm injury to infraspinatus. Pain on resisted external rotation may suggest infraspinatus tendinitis. Hornblower test. The examiner places patient arm to 90 degree in scapular plane and flexes the elbow to 90 degree. The patient is then asked to externally rotate against the resistance. This test is positive if the patient is unable to perform the external rotation. Now at the end we will see physical therapy management. In phase 1, our main focus will be on pain control. To control the pain, we can use cryotherapy. We can protect the injured tissue by using sling or shoulder immobilizer. Exercises such as pendulum and passive range of motion exercises can be performed. This is important for preservation of strength, which will speed recovery time. Phase 2. Phase 2 mostly start after 5 to 7 days after injury. In an overuse problem, this phase begins when pain diminishes. Range of motion is fully restored. Progressive resisted exercises are initiated to establish normal strength. Some example of exercise are rotator cuff strengthening, strengthening of scapular stabilizers. Restoration of strength and mobility of the shoulder is vital to allow for a successful return to sports. Here you can see examples of strengthening exercises. Third phase. Third phase is a sport specific training to return an athlete to a level of full recovery and maximal performance. Exercises needed to be tailored to be sport specific. For example, interval throwing program is used for throwing athlete, medicine ball rotator cuff exercises, and resisted band movements can be designed. Thank you so much. I hope so your concepts are now clear. You don't forget to like, subscribe and share this video with your friends. Thank you so much.